Good evening, everyone. I am going to be starting in just a second. This is our fifth installment of the Mental Health is a Serious Matter webinar series. And tonight we are going to be talking about suicide prevention, what you need to know in order to protect the ones that you love. But first, on behalf of our chapter, Xi Zeta Omega chapter of Alpha Kappa Alpha Sorority Incorporated, we'd like to welcome you on behalf of our president, Courtney Coffey, and our vice president and program chair, Tracy Harrison. And my name is Nicole Jones, and I do appreciate you guys coming to join us. I know we were 1 week off of our original schedule for this part of the webinar, and I just appreciate you guys coming to join us. Hopefully, you're joining us on our Facebook Live, but also this is being recorded so that you can replay it for those that may be interested in the information from our YouTube channel. So I am going to get started, and I'll tell you the reason that we were a bit delayed is that I was having some technical difficulties. So I'm hoping that we will be able to, you will be able to see my slides once I present them. I was having a little difficulty getting them uploaded, but I'm going to try right now so we can jump in. Okay. For some reason, it is not opening up my presentation. Give me 1 second. I am having some technical difficulties. Let me try to reload again. It says that my browser is blocking. 1 second. I'm going to try something. I'm hoping that you guys are able to follow. I'm going to share it with my whole screen and then put it into slideshow. And I'm hoping that you are able to follow. Doesn't look like it is showing my screen, which is unfortunate. Oh my goodness. My apologies. Let me try this one more time. Of course, technology fails us when we need it the most, but I am not going to give up. There we go. I think that we may have it. There we go. There we go. So I'm going to get started. Okay, thank you. Everyone is on board. Great. I am so sorry. Technology, it's all their fault. Not our technology, but the actual technology. Um, so I'm glad we got it going. Let me jump in. I'm going to start by sharing who I am, my introductions and disclosures. Again, my name is Nicole Jones. I am a licensed clinical social worker. I've been working in the field of clinical social work for, this is my 23rd year. I've been with the VA Maryland healthcare system, working at the VA Maryland healthcare system as a suicide prevention coordinator for the last 15 years. But I started my career at the Washington, D.C. VA. I was working with veterans that had substance abuse and mental health issues. And so suicide was something I was skilled at doing, comfortable with assessing, and very knowledgeable about the topic. But it wasn't until I lost my own cousin to suicide that it was something I became very personally familiar with. And I understood that suicide is a condition that you may be familiar with it, but it's hard to see in someone that you care about. And so that was what brought me to do this work. I'm a mother, a wife, a Christian. I have my own private therapy company where I am the CEO and clinical director, and we focus on therapy and education. So I'm going to go ahead and we're going to start talking about what you would need to know, but it's important to start with some facts. Suicide is the 10th leading cause of death in the United States. What's significant about that is when I started doing this work 15 years ago, it was actually the 12th leading cause of death. So as heart disease and cancers remain consistently at the top of the list, suicide is actually becoming more prevalent. The CDC releases its numbers every 2 years about statistics related to suicide, and they already predict that it may be the 9th leading cause of death when the data is pulled the next time. It is the 2nd leading cause of death among 12-year-olds to 24-year-olds. And that's, significant. The number one is car accidents. And I do remember hearing on the local news recently that it is actually very closely tied to car accidents now. So it's actually becoming more prevalent in our younger people as well. There's one death by suicide every 11 minutes. And since 2019, there's been an increase in suicide rates in more than half of the states. And I'll tell you that is pretty much correlated with gun rights in those states. And we'll talk more about guns and how they do play a role in suicide. There are approximately 105 suicides a day in the United States. There are more deaths as a result of suicide than from war and homicides together. And I just want that to sink in, that even though our program, I work with the VA, and our program was in response to veterans who were returning from Afghanistan and Iraq, more veterans have died by suicide, and this is correlated to the general population as well, but more veterans had died by suicide than they did by war. And so when you think about that, especially with homicides, we hear every day on the news about homicides. You just hear homicide after homicide, but the fact remains that more people die by self-injury with the use of a weapon than they do from homicide. And so it's just alarming. And suicide rates have risen among people of color over the past decade. So we want to think about our Black and Brown people and what are some of those things that have contributed. And I'll talk a little more about that as well. The more statistics continued, women attempt suicide more often than men. However, men die by suicide 3.6 to 3 times more, almost 4 times more. And it's related to the methods that are used. Firearms are the main method that is used by men. In 2019, 47,000 people, an estimated 47,511 Americans died by suicide. And this is according to the CDC. And you think about that, almost 50,000 people each year. That is alarming. It is indeed a national crisis, and we have to start talking about it more. Firearms account for more than half the suicides. And there's an estimated 1.38 million suicide attempts in 2019. But I do want you to understand that this is based on self-report. And so when you think about that, a lot of people don't talk about it. They may have had a suicide attempt and it didn't result in death or injury, and they just wake up and go on about their day. This always makes me think of the Hall of Fame football player, Junior Seau. And I tell this story when I do education because I do think that not a lot of people talk about suicide attempts, but we want to make sure that it's something that we think about, just like any other healthcare issue. But Junior Seau, who died by suicide 2 years earlier, had a near fatal crash off a cliff in California. And it just makes you wonder if, as a result of CTE, that he thought about suicide, that this injury might have been an attempt of his life, but yet he survived. But 2 years later, he did actually die by suicide. And so we have to think about the numbers of people that do report a suicide attempt. It is based on self-report. There are probably lots of others that don't get accounted for. 90% of those that have a diagnosis, who die by suicide, have a diagnosable mental health or substance abuse issue. And so what I like to really communicate is that at the core of what's going on with that individual, it's treatable. There are layers of things that are happening, but 90% of them are diagnosed with a mental health or substance abuse condition. And so we encourage them to seek treatment because it will reduce the risk. Now, some states are more at risk for suicide than others. So some state residents are more at risk for suicide than others. Actually, Maryland ranks 47th in the country, which means that we do a good job of, we do a good job, but it might be also related to our gun laws. It may be related to other factors, but we are ranked 47 in the country with regards to our suicide rate. Some other states, Alaska has a high suicide correlation rate, as well as some of the Indian reservation states, because there is a cultural impact to suicide in Native American culture. So I'm going to go to the next slide. I always like to add this slide because I believe language matters. And I want to make some distinctions as well with regards to suicide. And the reason is words have power. I also lost someone to suicide, but I learned something valuable when I started doing this work many years ago. A mother who lost a child by suicide really educated me, because I would say died by suicide. I mean, I would say committed suicide, as you know, we have historically. But when you think about the word committed, it has a connotation that's really negative. We say committed a crime, committed adultery. It really is related to things negative. And so I started changing the language. Excuse me. And also educating people on what they can say differently. You can say died by suicide, died as a result of their depression, anxiety, or PTSD. And so it really does help us to fight stigma, because it isn't something that they did and it was wrong. It has such a negative connotation. Also, ended or took their life instead of completed suicide. In the academic world, we do say completed suicide, but really, we don't. It's not a positive thing. It wasn't an accomplishment. We really want to make sure that the language is appropriate. Some people now say non-fatal suicide attempt instead of unsuccessful or failed suicide attempt. We don't want anyone to have an attempt, but to say a failed suicide attempt, it sounds like we're we're saying that we're encouraging it. And so we have to be careful of the language. A survivor of suicide lost compared to a suicide attempt survivor. A survivor of suicide loss is someone who lost a loved one to suicide. And, sometimes people do confuse that. You can be a suicide attempt survivor. And so it's good to know the difference. Also, when we think about lethal means, it's important to say safety and reduction instead of restriction because, we're all citizens. We have the right to own weapons if we choose to. But the main factor is we want to get across to people it's about safety and reducing risk, not about restricting, not about banning someone from having a gun. It really is about safety. And so we try to use that language in order to put people at ease. We're not trying to take away their rights. We just want to make sure that they're safe and their families are safe. And also trying to avoid the word crazy when it refers to people. We can talk about crazy situations. We can talk about all kinds of other things. But when we talk about people, it's important that we really refer to the mental health issue they're struggling with and not refer to them as having or being crazy. It's important that we really make sure that our language is not embracing or encouraging stigma. So when we talk about risk factors, these are the things that are on board that make us prone to suicidal thinking. And I'm going to go over some of these because these are the things that you want to know to keep in your mental in case there's someone you're concerned about that you can really have these risk factors in your mind. History of a suicide attempt. So if someone actually crosses that threshold and makes a suicide attempt, it really makes them more likely to think about suicide in the future. The statistics say that if those that have died by suicide, 25% of them had a previous suicide attempt. And so we want to ask that question of our loved ones if they're struggling, if these are things that they're dealing with. We want to know, have they ever thought about or attempted suicide, just as a way of being supportive. Family history of suicide. And that's important because we don't know why necessarily. It could be nature, it could be nurture. And all that to say, someone could pick up, could learn to engage in suicidal behavior. Maybe they grew up in a home where there was a family member who struggled with suicide or a family member who died by suicide. That could be some learned behavior. But also, I have to mention that NIH is now doing some research looking at the genomes and really determining if suicide risk is something similar to alcoholism, where you have a predisposition for suicide. And it could mean that it could occur in your family. I always use the Hemingways as an example. Ernest Hemingway had, I think it was 2 siblings, one parent and a niece who died by suicide. And so you think about that and it makes you feel as though there could be some genetic connection. And so in families where a suicide has occurred, it's important that there are focusing on postvention and resources and support so that others who may been at risk can actually get support that they may need to reduce that risk. Chronic pain. And that's a big one with someone like our veteran population, our elderly population. That can be a really big risk factor for suicide. If someone is really struggling with pain, they may feel like they would be better off dead. And so that's when it's important to, for our older population, manage their medication, especially if they're on heavy duty pain medication that could be fatal if taken or misused in any way. Be important to, monitor and talk with them about that. Someone who's having sleep problems, loneliness or isolation, Presence of a firearm in the home or vehicle, and that just any access to lethal means really does increase the risk for suicide. And so you think about people who carry a gun for their jobs. Police have a high incidence of suicide. Veterans, when they're active duty, also have a high incidence of suicide. And so the presence of the actual firearm really increases the risk. And so we're going to talk more about that when we go a little further about some things you can do to reduce that risk if you do have guns at home, how you can store them, and other things you can do to keep them safe. Relationship problems. And again, this is on top of the diagnosable mental health and substance abuse issues. These are usually the layers of the onion that really push people to that edge. Relationship problems, bullying in particular to our school age kids, that's a really huge risk factor. I was surprised as I've been working in the city of Baltimore for the last 10 years. It was about 8 or 9 years ago, there was a 6-year-old in a Baltimore school who committed suicide. And it was just horrible, horrific to think about. But the school, they did uncover, and the family did uncover that there was some intense bullying going on that really was the precipice for this young lady's, this young kid's death, which is really sad. Lack of support, financial problems, especially if there's a transition, like someone who may be retiring and having to now go on a fixed income, or maybe they have lost their home or lost their job lost their job and then lost their home as a result. Those can really be huge risk factors for someone. And also substance abuse issues. That cycle of addiction and recovery, it can be overwhelming for some people. And oftentimes they can feel a lot of guilt and shame about relapse, which also can be a risk factor for suicide. Okay, so those were some of the warning signs. Those were some of the risk factors. These are the warning signs. And these are the things that if you recognize these, you want to ask the question. And we're going to talk about the question. But if someone mentions thoughts of suicide, it's important that we talk a little more, ask more questions. Like, what do you mean about that? Tell me more. And you don't want to make judgment, because that person's going to shut down if you start saying, well, why would you want to do that? I understand that thought, because that's what we feel when we hear that someone we care about. I just noticed that all of these are doubled. Must have been a glitch. I apologize for that. But what I would say is that we want them to be able to open up to us. We want to be able to validate what they're thinking, even though we know that we're not encouraging suicide, but we want them to be able to openly express how they feel. But our goal is ultimately to say there are other options. There are other solutions. There is support. There is help. What happens when people start thinking about suicide? They have this idea in their head that they will be better off dead, or the people around them will be better off dead. And it starts off as a thought, but it may progress to more passive, what they call a passive death wish, where someone may be thinking about dying, but they're not actually committed to the idea of taking their life. But they may say something like, well, if today is the day that God takes me home, I'm okay with that. And it really is that first, that transition of thought, from a thought to now it's a passive death wish. And then even people think about a plan. They may go from thinking about it in their head, passively hoping to be dead, and then actually saying something like, I just wish I could go to sleep and not wake up. Those are the kind of things that really require us to take action and say, you know what, I'm concerned about you, and ask that question. And the question is, are you thinking about suicide? And I'll go into more detail about that, but it's important that we feel comfortable asking that question. Because a lot of times we feel afraid to ask. We're afraid they may say yes. We're afraid we wouldn't know what resources that to put together for them and help them. But really, what you're saying is, I see something, I'm concerned about you, and I have time. I am here for you. Let's talk about it. I have heard from those that I've worked with that it's an invitation to share something that they just have been afraid to tell anyone. I even had a veteran tell me one time, Miss Jones, you recognize something that not even my family recognized. And I reassured him, I said, your family probably recognizes, they're just afraid to ask the question. And so when you see any of these warning signs or you have some risk factors when you're assessing the situation, ask the question. You want to think about access to lethal means too. If someone is thinking about self-harm, do they have access to guns? What are they thinking of as a plan? Maybe they decided they wanted to go on the highway and at this particular bridge wanted to drive off. Then maybe thinking about them having access to the keys would be an important way to intervene. Someone may have irritable or angry outbursts, and that's not like them. So their personality is changing a bit. They may be using alcohol more or substances more. They may be giving away their personal items, deliberate self-injury like cutting behavior. And there's a big difference. Some people do engage in self-injurious behavior as a way of coping with their stress. They may cut their skin, see the blood. They feel like they're getting some relief from their stress, but they may not be considering suicide. But there are dangers to that. If someone is unaware that there are major arteries in your arm and they actually cut too deep, they can be at risk for suicide. And so it's important to know if cutting behavior is something that they do. Saying goodbye in a letter or maybe a call, and asking about lethal means. This is the conversations I have with some of my veterans is I talk to them to say, never share a weapon with a buddy. And we have some, really horrific stories of people who died by suicide who borrowed a weapon from someone else. And so we really talk about, making sure that if you have access to lethal means that it's safe, you keep it safe, and you don't loan it out because you don't know what other people are thinking. And then also loss of hobbies. So someone may be, they may be doing all kinds of different things, involved in different activities, and then all of a sudden they're just not interested in those things anymore. It's important that we really try to connect with them to see what are some of those barriers. Why aren't you going to bingo or to the senior center or to your veterans group, or even, someone, just going out with friends or in a particular social group? You want to ask those questions to see if there's something going on. These are protective factors. I'm going to go over some of these, but these are the factors that the more protective factors that are on board, the better protection from suicide. And I'm going to just kind of mention them, but I want to say, as I do whenever I do this training, is protective factors are great. Like I said, the more the better, but they're not foolproof. Unfortunately, someone can have a brand new job, something they've been looking forward to for many years. They've reached that pinnacle and still feel like they don't belong or like they don't measure up. And it still can be a risk for suicide. So let's talk about the protective factors. Family, having family, and I say family doesn't have to be blood. It's the people that you anoint to be your family. So any family supports, friends, family, whoever's there that you have a sense of connection with, that is important. Cultural connectivity is important. Having a sense of who you are in a culture, that can be very important. Social equity, feeling like you're valuable in society. And I'll talk a little bit about social equity, because for African Americans in this country, that can be a real burden. We feel as though we are not equitable members of our society, and that could lead to thoughts of inadequacy and thoughts of depression and suicide. Emotional self-regulation, someone who's able to deal with the ups and downs of life. Their academic achievement, career success, it's always a plus, but not always foolproof. Spirituality, and I always like to note the impact of the Black church. The Black church used to be the foundation of the Black family, and really, I think the decline of that impact has really decreased the protection of the Black community against suicide. And I'll talk more about that. And also someone who has help-seeking behavior. If they are willing to come in and talk about what's going on, that's a behavior that is going to bid well for their longevity and healing. Special populations at risk. Historically, when you think about suicide, older white males historically have been at the top of that list, and it still is. However, there are other areas, other groups, and other cultures that are also increasing in incidents of suicide and are disproportionately affected by suicide. Veterans are one group. Every 1 in 5 suicides is a veteran. And there was a time that it was 20 veterans per day. Currently, it's at 17 veterans a day, but that's way too many. And there are unique experiences that those who have been in the military have had, whether it be deployment. Sometimes our women are sexually assaulted in the military. Sometimes there's discrimination in the military, and those factors are unique for our veterans and can really increase the risk for suicide, in particular combat experience as well. Our LGBTQAI plus population also is a special population that is an increased risk. Youth and young adults, especially in the African American community, there is a distinct rise in the incidence of suicide, and I'll talk a little more about that as well. And our Native American culture, there is high incidence of suicide also, and they don't really know what the risk factors specifically are, but it's something maybe similar to what we talked about before, social equity. Unfortunately, our Native Americans who really were residents of the United States before it was officially discovered, really got pushed northward and westward in this country. And that can be a risk factor, that they feel like they're not part of this country, don't have the same rights as others. Police officers, another line of work that has a high incidence of suicide is dental, I guess, practitioners, in particular dental doctors, which I thought was interesting, and construction workers. And then I talked about frontline workers with COVID because basically these are just special populations. They were really overwhelmed when COVID first started. Some of these medical professionals who are seeing people die every day in masses were really affected, and there were a high number of suicides associated with COVID frontline workers. Okay, and I skipped that myth, but the myth of suicide, one of the things I really want to talk about is asking about suicide. There is a myth that says that if you ask someone about suicide, you're planting the idea in their head. And that's just not true. What you're doing is asking them about something you see and that you're concerned about. And so what I recommend for really anyone, and I go down these list of people that really should have as part of their work and as part of their life should be engaging in some kind of suicide gatekeeper training. And if you look over to the left, I'm going to talk about some of the gatekeeper trainings. Operation Save is one that the Veterans Administration does that really talks about veteran risk for suicide. And their Veterans Crisis Line, which is a crisis line that's set up specifically for those who have served in the military. It's really the same number as the National Suicide Crisis Line. And I will return to make sure everyone has all of this information at the end. But then our Veterans Press One. So this really gives a little information about veterans' risk for suicide. It's really recommended for veteran family members, those that have veteran loved ones. Talk Saves Lives. And this is one that is offered by the American Foundation for Suicide Prevention. And there is a Maryland chapter of that organization, and they do this training a lot of times for free. But you can reach out to the local chapter to see if they would provide that. Mental health first aid, which is a very basic 101 kind of training about mental health, but really kind of similar to regular first aid, where we find out how to wrap someone who's bleeding up so that they don't bleed to death. We want to make sure that you know exactly what to do when someone has a mental health crisis and what that could entail. And so mental health first aid is another gatekeeper training that is really perfect for, knowing what the risk factors are and how to engage when someone is in crisis. Another one that's popular with the school system is QPR, which stands for Question, Persuade, and Refer. And so basically, excuse me, this gatekeeper training talks about asking that question, persuading that person to get help, and referring them. All of these are great gatekeeper trainings. And as I said, I recommend it for family and friends of someone who's struggling. I think that all teachers should be aware, because unfortunately, they see the students all day. They may pick up on some things that may be going on, but they may not really know how to deal with it. So it's important that teachers are armed with the resources to help. Excuse me. Coaches. I talked a little bit about sports and suicide, but the reality is that those that have a life that is been filled with sports and achieving through sports, that can be a really difficult transition, especially when maybe they've had an injury. Excuse me. Pardon me, I'm going to take one drink. Okay, my apologies. But working with young athletes is important. I will tell you that at the collegiate level, collegiate athletes, that suicides happen often. And it's important that coaches are armed and athletic staffs are armed with the resources to know exactly what to do. All of our healthcare providers should really be aware of suicide, have a gatekeeper training, and know what to do. Social workers, psychologists, psychiatrists, medical doctors, these are all professionals that should know how, and nurses, should know how to assess for suicide and be able to help in a crisis. It's important that coworkers, sometimes it's unfortunate, but even in our work setting, someone can be struggling. And so in a workplace, having a mental health support system in place, like, of course, EAP, some employee assistance program where employees can get counseling, but also something where coworkers may be able to recognize something in their coworkers and make some help and offer some help. Pastors, chaplains. I always like to talk about the church and suicide, and in particular mental health and suicide. But there was a time where you would go to a church and you could go to any church and, someone would say, well, I've been struggling with depression and thoughts of suicide. And the pastor would say, well, you just need to get closer to God and pray more. and come to church on Sundays and Wednesdays. And so, you know, one of the things I'm happy about, and we do this at the VA, and I do see that the church is taking really more ownership of mental health and the church, and really becoming a real resource to their parishioners. But it's important that pastors and chaplains know what to do to be able to talk with someone in a crisis and give them real advice. Case managers, lawyers. We've been called to the scene of a suicide at the courthouse. Not a suicide attempt at the courthouse, where someone was in pending charges that would put them in jail for many years. So it's important that people in that arena, as well as forensic workers who are like in our jails, and probation officers, police, EMS, firefighters, and in the military. So these are all of the areas that I really do think they should have, and I encourage to have that gatekeeper training, because it really helps them keep their skills so that when a crisis arises, they know exactly what to do. All right, so moving along to the next slide, I want to talk about the river of suicide risk. And we talk about it as a river because it does ebb and flow, and it streams from one place to another. So we think about prevention. Prevention is where we, during normal life circumstances and problems, having normal life circumstances and problems that can lead to suicidal behavior. So we want to enter, like we're doing prevention today. We're saying these are the things that you should know in order to prevent, to really build up some skills and resources that can help in a crisis so that it doesn't get to the place where that person is actually thinking about suicide. Because if they get to that place where they're in crisis and they're thinking about suicide in that moment, that requires intervention. And so that's where we're actually in the midst of the crisis and we're intervening to get them some support. And that would mean, and I'll talk some about some of those interventions, but it could mean having a plan of action so that if they're thinking about suicide, there are things that can distract them and that you can get them to some help. But even after a loss to suicide, or someone who's had a suicide attempt, there's a such thing as postvention. And basically it is the support for those that are either left behind, or if someone had a suicide attempt and it was unsuccessful, and we want to help get them to a better place, that could also be postvention. But really it's dealing with the loss. I'm going to talk about loss right now, but for those that actually had a loss, to provide some support at the time of loss so that they don't in turn become at risk and that they can heal from their loss. And so it's really like a continuum that we want to prevent and not even get to the point where people get into the place where they're critically thinking about suicide and that interventions are necessary. But even in loss, we have to be sure to provide some support in order to prevent future loss. Some recommended treatment modalities for those that may be struggling with suicide. And I'm talking about suicide, but it's probably a combination of things: suicide with their depression or suicide and anxiety. Most of the time it is coupled with another mental health condition. But some of the therapies that are helpful, treatment modalities that are helpful, would be talk therapy. Sometimes having a therapist and really kind of being able to talk about things that are going on and have some problem solving advice, as well as some clinical strategies that can be useful, can be very helpful. Sometimes people really need talk therapy and a combination of medication as well. And that's because some depressions are more of a chemical imbalance and require medication in order to help them get back to their regular functioning. A suicide safety plan is a plan of action to keep the person safe. And it goes over what they will do if they start having suicidal thoughts. It may start with some things they can do independently, like listen to their favorite playlists, go for a walk. The next kind of phase would be things they can do that are social, like go to the movies, go to lunch with a friend, go to church or an NA or AA meeting. And then it gets more intense. Maybe then they have to call a friend that knows that they struggle and they can talk with that friend about what's going on. And then if that doesn't help, they want to engage their professionals. So it's a real plan that helps them stay safe when the crisis occurs. They can engage in mental health treatment, outpatient, like I said, talk therapy can be outpatient. They can engage in residential treatment, which is where they stay in a treatment facility and learn hands-on those skills that they may need. But they can probably, residential, they can probably come and go. They're not in an inpatient setting where they have to stay hospitalized. But there are times when someone is suicidal to the point where they need to have that protection of a hospitalization. And it may be against their will at times. And that's just for safety measures. But after they leave the hospital, then it's important that they continue to engage in therapy to help reduce that risk overall. Developing healthy coping skills is important. And also, I want to just put a little asterisk here, always thinking about lethal means and access to lethal means when there is a crisis. Sometimes we've created a plan with a family to say, okay, if you haven't been taking your medication and you start having any thoughts of suicide, we're going to remove the gun from the home and your brother will keep it for safekeeping until things are better. It's just important to really discuss that openly. I wanted to add this, and I know we're coming close on time, but we're just about there. 5 reasons suicide is on the rise in the Black community. I thought that was important to talk about. And some of these are consistent in other communities as well. Social media is ramping up the pressure to fit in. You look at social media, you see people enjoying what we call their best life, and maybe you feel like you're not measuring up. You're not as good as, or maybe even some bullying. Social media has increased that access to people saying mean things, which can also result in an increase of risk. Mental health stigma impedes Black people from seeking help. And I think that's real. We have to really address that in our community to encourage people to seek help. And, as a family, really support those who are engaged in mental health treatment so that they don't feel stigmatized. Something's not wrong with them. They're not weak. It's not a sign of weakness. And we need to really resist those stigma, and encourage people that mental health is overall health. Treatment for mental health issues is often less accessible to Black people. So thinking about insurance and what kinds of insurance and care, what quality of care is available is important. And sometimes they just don't have, everyone in our community doesn't have access to it. And also to the social equity issue that we mentioned before, Black people continuously face racism and discrimination, and that can be a big risk factor. Also, they are frequently exposed to violence, and that doesn't necessarily mean that they live in neighborhoods where it occurs, but maybe they are exposed to it in their communities because they hear of other people who have died by gun violence, hearing it on the news all the time, knowing it's around the corner, or even some of our young people have seen the violence firsthand and it becomes normalized. And so that's a really big issue. And so then what happens is they think about that as normal. Oh, I saw a dead person yesterday. It's not nothing. I see that all the time. And it really does minimize the impact that trauma has. And so there are lots of people walking around and experiencing full trauma, but not really in touch with it. So the charge is that we have to normalize mental health, just like we do physical health. We should start asking people, how you been doing with your diabetes? Oh, okay. How's your mental health? Encourage those who are struggling to seek support. And I always laugh when I see this, but it's so true. Check on your strong friend, because those that are really appearing to juggle it all may be overwhelmed. And I know that's consistent with the students. When you think about, unfortunately, suicide that happens with students, it's usually those overachieving students, the ones that are at the top of their class. They've been accepted to every college. They are just all around superstars. But what people don't know is they're carrying a lot of pressure, and they're not talking about it with people. So the lethality of guns, I'm just going to briefly go over this. As you can see, it's 85 to 90% fatal. If someone's going to shoot themselves, they're probably not going to shoot themselves in the foot. And all other methods combined is just 5% fatal. And so what we know is, if we can minimize the access to lethal means, we can reduce the risk for suicide. So what I encourage people to do is have a lockbox for their weapons if they choose to have them in their homes. Make sure that you have a lockbox, a combination, a key. These are cable locks, which are good because they go through the barrel of the gun. And this one has a key, but some have a combination. They're different ones. For those that are at risk and may live alone, we encourage them to put their weapons in a box that's called their hope box. Make sure that it has pictures of their family, things that they want to do, so that if they ever have to open that box, that they will be reminded of the people that care about them and the life that they want to continue to live. But we can't just talk about guns. We have to talk about pills as well. There is an increase of fentanyl deaths and opiate deaths as a result of addiction. But what people do also is, if they're struggling and they have access to these pills, they may use them to die by suicide. So it's important to, for those that are maybe taking pain medication, maybe they need a pill box so they don't have access to all the medications at one time, or a lockbox. Have the family administer the medicine. Dispose of unused medications. Sometimes we may have old medications in your cabinet. You want to make sure to clean those out on a regular basis so no one comes to your home and, takes your medication. You probably wouldn't miss it, but people do that, unfortunately, who are struggling with addiction. But also, if there are loved ones in your home that may be struggling with depression, may consider medications that are old or that are in the cabinet as a means to harm themselves. And anyone that has a loved one that is struggling with an opiate addiction, or maybe may have taken an overdose of opiate medications in a suicide attempt, a Narcan kit is something that you want to think about. And this is available at CVS. Most pharmacies, you can get a Narcan kit. And it's basically a medication, naloxone, that reverses the effects of opiate. And so you can reverse someone's accidental or intentional overdose with these kits. And they're very simple to use. They have instructions, but it's very simple to use if you ever are in that situation. All right. Suicide prevention tips for families. This is important information for loved ones. What we want to do is to make sure that we're engaged with our loved one and part of their plan to keep them safe. And so one of the things I encourage, if your loved one is engaged in treatment, sign a release of information. It's called an ROI form. And if you are a healthcare provider, you know exactly what I'm talking about. But if you're not, it's a form that allows you to communicate as part of your loved one's treatment team. You can talk to their doctors. You can, find out when their appointments are. It's just a way to be involved. And I think it's very helpful because you can ensure that they're doing the things that will help them stay healthy. But you do it in a respectful way. You want to say, hey, how are you doing in treatment? You know, is it okay if I come with you? Or maybe can I come in for the first 5 minutes? Can I talk to your doctor just to see if there's anything I can be doing? You don't want the person to feel like you're taking over because you want them to be empowered. But you also want them to know that you're part of their team and you're going to make sure that they're doing what they need to be safe. Encourage them to have a safety plan and action for crisis. Remove the guns or pills when the risk is high. And be comfortable asking that question, are you thinking about suicide? And as much just all the time, be non-judgmental and supportive. Some people have resilience where they could go through a lot and they're strong, but some people just are not built the same. And it's not a negative or a positive. We're all different. And so it's just important that when people are vulnerable and show you that vulnerability, especially when it comes to something so important as life and death, you just want to remember that they just need you to be there in that moment to support them and help them get some help. So this is a resource page. I have 2 of those, and I want to just start by talking about the need for more mobile crisis. And I've included pretty much a lot of the counties here. I did not include the District of Columbia. I'm not sure. I wasn't able to find out if they had a mobile crisis team. I am going to look and I'll add this to the comments page if I do find that, but I wasn't able to find it. But what I wanted people to know is that when your loved one is in crisis, sometimes calling 911 is not the best option. And I will say this because I know firsthand, but sometimes people do call on our police and they do an outstanding job, but sometimes they're just not trained to deal with mental health crises. And it's a very difficult and scary situation when we have a loved one who is in crisis and wants to die, and there are people who are not trained to deal with it. And so I wanted to include this to ensure that if anyone had a concern about a loved one and you thought you needed to dial 911, this is also another resource. I want you to have your cell phone so that you can take a picture, save it somewhere, because the reality is these mobile crisis teams, they have licensed professionals who are trained in mental health. They are skilled in crisis intervention. Some of them do work with the local police, but it's important that these crises be handled with care. Unfortunately, people have called 911 to assist with a loved one and ended in tragedy with that person being shot by the police. And so I want you to use this resource. If you have a crisis, those mobile crisis teams can help you get to some support. They sometimes come to your home and do an in-home assessment of your loved one. And even some do transport to hospitals. And it is completely safe. They are licensed professionals, and it helps to really take the burden out of our police departments, who often are not skilled to do that. Here's some resources I also wanted to add that are some really good books. And there's one that I didn't add, but you can write this one down. It's the Unapologetic Guide to Black Mental Health. And I don't have the author, but I actually thought I had it on here. But that is a really good book that you can use too. But here's some that just help expand your knowledge about suicide prevention. Black suicide, the one How I Stayed Alive When My Brain Was Trying to Kill Me is a woman's interpersonal journey with her struggles with suicide. And then there's one here that's really good for parents of teens. Another 2 documentaries that I love and I share with people, the Bridge documentary. It's about the Golden Gate Bridge and how it is the most jumped bridge in the United States, but how they turned it around through legislation to add netting to prevent anyone from dying off of that bridge. And the ripple effect is by one of the individuals that jump off the Golden Gate Bridge. His name is Kevin Hines, and he talks about his journey from jumping off the bridge. And he's only one of 32, only one of 3 people to survive, but the only one to really get full functioning of his life back. And he's now a suicide prevention advocate. So there's just some information that you can seek out. And I'm going to look and see if we have any questions. So I'm going to stop sharing now because I'm afraid that if I try to do these both at the same time, I am going to disconnect. So very well. I'm going to look on the comments and see if there was any questions that I can answer. Let's see. Oh, great feedback. Yes. And disposing of old meds by taking them back to the pharmacy to discard safely and not tossing them in the trash or flushing them down the toilet. Exactly. They also have med disposal kits where you pour water in with the medication. It actually dissolves the medication in a pack, and then you can throw it away because it secures it so that it's not exposed in the water. It's not harmful to animals, those kind of things. So thank you for that extra comment. Well, it looks like I'm glad that people enjoy the information. If it saves one life, we've done what we came to do. The reality is, and as I said, I lost someone to suicide. I lost 2 loved ones to suicide since I started, since I've been in this field. I lost a second loved one. And so I know firsthand, you can have the information and you can know the resources, but sometimes you can't control everything. But what I will say is having the information, knowing the resources, it gives us a chance to help those that are struggling, those that we care about, and get them to the support that they need. So I just thank you guys for this opportunity to share this information. I hope it's helpful. As I said, it's on our YouTube page, and please share it with someone that you think might benefit from it. Again, we have our next segment coming up. Let me just get the date. It is going to be October 24th. So please join us. Thanks again and have a wonderful evening.